Okay, good afternoon, folks. This afternoon's topic B is explores a new potential uh, explanation for chronic pain. Okay, so we're going to go through this one today for B. So please join me in today's presentation B. The article explores a new potential explanation for chronic pain, particularly in conditions like fibromyalgia and complex regional pain syndrome. Researchers suggest that cases of persistent pain might be caused by autoantibodies, antibodies that mistakenly attack the body's own tissues. This would be categorized certain types of chronic pain as autoimmune conditions similar to multiple sclerosis or type 1 diabetes. The theory was presented at the British Pain Society annual meeting and could lead to new treatments and blood tests to identify those affected. Dr. Rajesh Ray Rajesh uh, to identify those Rajesh among Rajesh Mong Glenny Monglenny, Vice President of the British Pain Society, emphasized that this research helps shift the understanding of chronic pain from being purely psychological to biomedical. If chronic pain conditions like fibromyalgia and hold on complex regional pain syndrome are indeed linked to auto antibodies, it could open the door for new immunological treatments. Some possibilities include, give me 1 second, guys, autoantibody targeting therapies, similar to treatments for autoimmune diseases. Researchers could develop drugs that neutralize or remove harmful antibodies, reducing pain symptoms. Immunosuppressants, medications already used for conditions like lupus or rheumatoid arthritis, might be uh, repurposed to help those with chronic pain caused by immune system dysfunction. Plasma exchange, a process that removes certain antibodies from the bloodstream, potentially alleviating symptoms in severe cases. Personalized medicine approaches. If blood tests can identify autoantibodies, involvement in chronic pain treatments could be tailored to individuals, improving effectiveness and minimizing side effects. The research represents a major shift in the understanding of chronic pain, moving away from purely neurological explanations toward immune system involvement. Let me know if you'd like to explore specific drug candidates or clinical trials, developments, auto antibodies are antibodies that mistakenly target the body's own tissues instead of foreign invaders. In the case of chronic pain, conditions like fibromyalgia and complex regional pain syndrome, researchers researchers suspect that these auto antibodies may attack nerve cells or pain processing pathways, leading to persistent pain signals. Here's how they might contribute to chronic pain: nerve damage or inflammation. Auto antibodies bind to nerve cells, disrupting their normal function or triggering inflammatory responses that amplify pain. Sensory system dysregulation. If auto antibodies interfere with pain receptors or neurotransmitters, they could cause heightened sensitivity to pain, a phenomenon seen in conditions like fibromyalgia. Prolonged immune activation. The immune system may continuously produce inflammatory signals presence of due to the presence of antibodies, keeping pain levels high even when there's no injury. The new perspective suggests that some cases of chronic pain might be autoimmune in nature, similar to conditions like multiple sclerosis or rheumatoid arthritis. If confirmed, it could lead to groundbreaking treatments that target the immune system rather than just managing pain symptoms. Would you like to explore how existing autoimmune therapies might be adapted for chronic pain? Researchers still investigating which chronic pain conditions may be linked to auto antibodies, but early findings suggest involvement in several disorders. Based on current evidence, likely candidates include fibromyalgia, studies indicate that autoimmune or autoantibodies might contribute to the widespread pain and sensory sensitivity seen in fibromyalgia. Complex regional pain syndrome, or CRPS. Some cases may involve anti and an autoimmune mechanism where auto antibodies attack nerve cells, leading to persistent pain and inflammation. Chronic inflammatory neuropathies. Conditions like Guillain-Barré syndrome and chronic inflammatory Demyelin or polyneuropathy or CIDP involve immune attacks on the nervous system, resulting in chronic pain and sensory disturbances. Post-viral syndrome, or it's e.g. long COVID. Evidence suggests that autoantibodies may play a role in long-lasting post-viral pain conditions. Autoimmune diseases with chronic pain features. Conditions like lupus, rheumatoid arthritis, and multiple sclerosis involve immune-driven damage that can lead to persistent pain. These findings shift the understanding of chronic pain toward autoimmune framework, opening possibilities for new treatments that target the immune system. If research continues to support this theory, future therapies might involve immunomodulatory approaches, similar to those used in autoimmune diseases. Would you like a deeper look to look at a specific treatment approaches based on these findings? Autoantibodies are antibodies that mistakenly target the body's own tissues instead of attacking harmful pathogens. In the context of pain, of chronic pain conditions like fibromyalgia and complex regional pain syndrome, researchers suspect that these autoantibodies may play a role in disrupting normal pain signaling. Here's how they may contribute. Nerve cell targeting. Autoantibodies may bind to nerve cells, interfering with their ability to transmit pain signals correctly. This could lead to persistent pain even in the absence of injury. Okay, inflammation and immune activation. These antibodies may trigger chronic inflammation, keeping the immune system in a heightened state, and sensitize pain pathways over time. Sensory system dysregulation. If autoantibodies attack pain receptors or related structures, they could make nerves overly responsive, causing aggravated pain responses, prolonged pain perception. By altering the way the nervous system processes pain, autoantibodies may cause long lasting or widespread pain characteristic of fibromyalgia. This emerging research reframes some chronic pain conditions as autoimmune disorders rather than simply neurological or psychological ones. If confirmed, it could lead to new treatments targeting the immune system rather than just managing pain symptoms. Would you like to explore potential therapies based on these findings? Several emerging therapies aim to neutralize or regulate autoantibodies, offering potential new treatment avenues for chronic pain conditions with an autoimmune component. Here are some promising approaches. Monoclonal antibodies. Monoclonal antibodies. Engineered antibodies can be designed to block harmful autoantibodies or modulate immune system activities. Drugs like rituximab used in autoimmune diseases may be adapted for chronic pain. Plasma exchange. Plasmapheresis. Plasmapheresis. This process removes autoantibodies from the blood, potentially reducing inflammation and pain in severe cases. Intravenous immunoglobulin or IVIG. This therapy floods the body with beneficial antibodies, helping to neutralize problematic autoantibodies and regulate immune responses. Targeted immune modulation therapies that selectively adjust immune function rather than broadly suppressing it could reduce side effects and other or offer more precise treatment. Gene therapy, mRNA based immunotherapy, advances in genetic medicine may allow for direct suppression of modification of antibodies production. Okay, guys, give me 1 second, please. These strategies could revolutionize chronic pain treatment by shifting the focus from symptom management to immune system correction. If research continues to confirm autoantibody involvement, personalized medicine approaches may lead to tailored therapies. Would you like to explore specific clinical trials or recent breakthroughs? Okay, guys, so that is B for you. Give me a little bit for a break, please, and I'll be back on with you for C. Give me a few minutes, please.